Hi, I'm David, dairy farmer in North Nottinghamshire.
Hi, I'm Dr. James Wilson. I'm a foot health consultant working with Herd Health Consultancy.
I'm Alex Burrows. I'm a professional cattle foot trimmer and chairman of the National Association of Cattle Foot Trimmers.
And I'm Harry Warby. I'm a veterinary surgeon working for Ceva Animal Health.
As part of an HDB Dairy sponsored PhD project, Dave and myself conducted a 3-year-long randomised controlled trial here at this farm in North Nottinghamshire, Dave's farm. We used the non-steroidal anti-inflammatory drug ketoprofen in a range of different treatment modalities in both heifers calving into the study for the first time and adult cows that were already milking when we began the trial. And what we identified was that by implementing the early detection and prompt effective treatment protocols, so spotting lame cows fortnightly and treating them in the 48 hours after that identification, with the combination of a trim, a block and 3 days of ketoprofen beginning from the day of treatment, we could dramatically reduce the risk of lameness and culling over the 3-year period in the heifers, only when taken in combination with 3 days of ketoprofen being administered postpartum after calving. So using ketoprofen very proactively around the time of calving and also at lameness in heifers presented a substantial return on investment. It was £1.66 to every pound invested on this farm, which is great. Quite dramatically, in contrast to that, we found that actually with the adult cows, we had a much smaller effect. We didn't actually identify any significant difference when using ketoprofen, which is really interesting. We understand that ketoprofen in managing lameness is really important for the immediate treatment and welfare of that animal's lameness case, but actually our best return on investment and our best efforts are put in managing the heifers. Giving those heifers ketoprofen and treating them as early and effectively as possible is really, really important because we'll reduce the risk of lameness and the risk of culling at any time over that 3-year period. So just off the back of that, Dave, I'm wondering, what did you think of those results when we first found them and how have you taken those forward on your farm?
Yeah, extremely surprised by the results, particularly the non-steroidals going to heifers sort of post-calving,
Yep.
or pre-calving, as some of them was. And it seems such a simple way to implement quite a big change without even picking a foot up.
Yeah.
And it's something that's quite easily implemented on the farm.
Yep.
All you need to do is, as soon as they've calved, you're giving them 3 doses of NSAID, and that, you know, we're starting to see, I guess we're starting to see less severe soil hemorrhaging. We still see it,
Yep.
but even just picking a foot up and seeing a reduction in it has really sort of opened your eyes even more to the fact that it's definitely having a use on farm. And according to the trial, it means that you're going to get some longevity out of it.
Yeah.
And heifers, tie up a lot of cash, and you're trying to get them into the second lactation, and that is all part of it. There's, it's potentially massive, really.
Yeah. And in terms of not just the farm sort of economic side of things and sort of the hard science of it all, picking up those early lesions and only finding actually quite mild lesions relatively. Yeah, from a welfare perspective, how do you feel about giving anti-inflammatory around calving or after calving in particular?
It's sort of a bit of a no-brainer, isn't it, really? And I think for some reason we've not cottoned on to it earlier. It almost didn't really need a trial to understand, but I think putting some science in it really has made you think, it really is a no-brainer, because like everybody feels better when cows are walking better.
Yeah.
Your milk buyer does, the staff do, I do personally, and to have something so easily implemented it's great.
So are you, what sort of regime are you trying to follow through with your heifers now for calving and lameness management? How does that look on your farm at the moment?
So calving, I don't really need to explain to the staff members about the use of NSAIDs for calving, because that should be obvious, but explaining that it's also having an impact on lameness severity.
Yep.
So as soon as they calve, it's simple. As soon as their first milking comes about, it's injecting the various NSAIDs that you need. And from then, they get enrolled in, the daily, lameness hoof care that we do. So it's mobility scoring every 2 weeks. I've brought, so we do a lot of routine trimming. It was 90 days and 200 days.
Yep.
I brought it forward a little bit for the heifers. So we brought that more to 60 days.
Yep.
And we're starting to see even less severe lesions, particularly in the sole ulcer site.
Yep.
And from then on, it's hard to sort of visualise the improvement, but with everything we're doing and the NSAID use, I think we're only going to see it keep improving, and hopefully we'll start seeing longevity. I think we already are starting to see that a little bit.
Awesome.
In terms of our average lactation, I think that's edging up, and that's part of it, along with all the other management that goes into it. That's surely going to be part of the process.
And let's say you had a heifer in the crush that you found a bruise on, or maybe was responding on hoof testers. What's your follow-on once you found that? What are you doing now, and then how do you find they respond to that as well?
So you're right. We do use hoof testers, and so it's a case of if you get a reaction from the hoof test, it's block and NSAID, and actually we've started doing a bit of IV if we do have a severe lesion, trying to do IV, and I think it's a little bit anecdotal, but we feel like we get a quicker response in terms of their mobility and the improvement we get from it, and it's about monitoring her from then on. So in the next 2 weeks, what's she scoring like? Is she worth picking up again? And we'll probably leave it. And 9 times out of 10 they'll be left a month, and hopefully that block stays on. And I think we've probably seen better treatment outcomes really from it.
Awesome, brilliant. So now's probably a good time to bring you in, Alex, as well. Okay. So obviously you've seen a lot about the trial results. We've worked together for quite a long time as well, and you've heard me talk about it quite a long time. I'm just wondering, how are you trying to promote to your clients about heifer management? What aspects of this type of work are you taking to your clients, and how are you best finding that works?
Yeah, quite a lot of my clients weren't necessarily trimming heifers post-calving at all, really, until later lactation, so drying off trims, or unfortunately if the heifer went lame. I dare say most of my clients, if not all of my clients now, are trimming post-calving. So a check. It's not necessarily a trim, but definitely a check. And for me personally, we tend to see certain farms that I know, whether it's down to the heifer rearing. We have some farms that are purely on straw, and then as they calve, they're transitioning onto concrete, and we do tend to see more issues with them heifers. So we have quite a few farms that have altered their heifer rearing to get heifers on concrete earlier. Some of my best farms with the heifer lameness and levels of hemorrhaging actually have heifers on cubicles from a very young age, and then even go on to straw for calving. But I think that concrete at a young age makes a massive difference. I have a few farms that are going down the NSAID route, definitely. I have a few farms that are a bit touchy about it, a bit edgy, and I think so it can only help getting the education out to the farmers and getting these trials pushed further afield, which I've done. I've shouted about your results a lot, and because they have been fantastic, and if we can push that and reduce the national lameness average, it can only be a brilliant thing for the dairy industry and British agriculture overall. But we've seen a lot of my clients go down the route of trimming around 80 days. Some of them have been fine. Some of them we've edged back, like with you, Dave. You've gone to like 60 days. A few of my clients have done that. Some of them have been like towards 80 days, and when we've been fine, we've checked hooves, we have seen hemorrhaging, hoof testing. If the other claw is sound to take a block, then we've blocked them, and we're seeing good results. We're seeing good results, real good results.
Do you find most of your clients are willing for you to be really proactive with those blocks and promote anti-inflammatory usage as well?
Yeah, I've had some farmers. I don't think it's a cost thing in terms of blocking, but I think some farmers are quite cautious with wanting us to block and over-blocking as such. Like I say, not for the monetary side of things, but it is a hell of a lot of pressure you're expecting a cow to do, to walk, at such a young age and a young period in the lactation as such. But hoof testing that medial claw, as long as it's sound and she's no reaction, she'll carry a block. But it's follow-up treatments as well. It's not just leaving that once you've done her, she's done and that's it. Whether that block's on for 6 weeks, whatever, it'll stay on until it falls off. And you can't do that. You've got to do the follow-up treatment.
I think that's where the 2-week mobility scoring comes, isn't it? And even if you're not going to do anything with her, it's just monitoring, right, how is she on that block?
Yeah, because 2 weeks later, you can see a vast improvement over that 2-week period. You've seen it day to day, Dave, when you're seeing her through the parlour. But then the following mobility score, actually, you might see a slight dip in her mobility. And then you can think, well, we'll check her and we can remove that block if that's necessary. And
it's only a couple of minute job, isn't it?
Exactly.
Getting her in and checking, isn't it?
And it's interesting, I think, with a lot of the blocks that we're getting out nowadays, the softer blocks and the wedge blocks and different shaped ones, actually that can give us a lot more reassurance when we're applying blocks. And I mean, you've taken the words out of my mouth. Recheck is just so essential for these, especially young animals with the early stage disease.
Definitely.
Make sure the block's not misshapen, it's not being worn in strange ways. We need to manage the expectation with a recheck that actually the block might sometimes need to stay on completely for another couple of weeks, mightn't it? So, no, that's awesome. And I'm just wondering, Harry, from your perspectives in terms of promoting that proactive use of anti-inflammatory on farm, what messages do you find tends to work? How do you tend to work with farmers to promote pain relief and anti-inflammatory usage as well, a proactive approach to treating mild lameness?
The first thing that should be at the forefront of all our minds, I think, one of the reasons we're here today is welfare. We as an industry, we are in the public gaze at times, but we need to care for these animals. We have a duty of care. That's why we do what we do. And frankly, if you look after them, they'll look after you. So really can't underestimate the welfare side of things. Like you say, James, you wouldn't want to give birth without pain relief. I used to make the same arguments to people about disbudding and castrating. When they didn't necessarily want to use an NSAID. But the clear benefit you've shown with your work, which I found really interesting, that there's that financial payoff from getting them so early on in their development. We focus historically right through young stock rearing. That start is key. And it would appear that from your work that we perhaps underestimated how far that sort of good start has to go for us to really maximise and optimise their performance later on in life, and as you say, Dave, their longevity.
Yeah, it's massive.
I think those heifers sort of carve in for the first time or enter our milking herd almost pristine. If they've had a good rearing period, they come in and they are immaculate. They're in really good, healthy working order. There's some biological things that can mix up, but I think we need to try and preserve the structure of the foot, preserve the structure of the nervous system. If they experience pain, that can alter the nervous system of the cow, and actually be really proactive in that, because, as you said, that just pays dividends, not just from a financial perspective, but actually just from an animal welfare perspective. Yeah, that's critical, isn't it?
You're minimising a stressor. A heifer that's calving in for the first time, unless you have your own dedicated group, quite often they're turned out into a group, with a bunch of cows that are bigger than them. They've got their own hierarchy. You're upsetting that hierarchy. They're going to be a level of bullying. They've got to be able to move around, get away, do what they need to do. So if you can take a stressor away, take a form of discomfort away from them at a very transitional phase of their life, then it's only going to be a good thing for them.
So from the conversation we've had today and the trial results that we've published recently, it's really clear how important taking a very proactive approach to managing lameness is, particularly in respect to anti-inflammatory usage. And that's on two parts. One is managing the individual case, the individual cow that is experiencing lameness, and actually trying to get a positive welfare outcome out of that and optimising our cure rates. And then on the other side of it is the longer term management of our heifers, ensuring that our heifers are going to be as successful as they can be for the rest of their productive lives is really, really important. And the use of ketoprofen throughout their lives to manage any kind of lameness or calving event is a key part of that story.